Today I wanted to get into coronavirus vaccine race and the top 5 companies who I think are going to be the winners or a few winners in these top 5. I'm going to be breaking down all these companies' feats, what they've achieved. I'm going to be talking about the phase they're in right now, the funding they've received or are likely to receive, the results from their trials, and their future outlook in terms of delivering the product. Okay, so one thing which is common in all these companies that I'm looking at, no matter what, is the ability of their vaccine to produce neutralizing antibodies. The antibodies are the things which block infections, and the production of T cells. T cells, they're basically the cells, the natural cells, which are able to fight off this infection and produce immunity for a consistent time period, consistent time frame. Okay, so the first company on this list is going to be Moderna. So Moderna, as you know, it's the company which is known to the mainstream quite the most, just due to the fact of its success and its very, very efficient PR team. So anyway, Moderna was the first company to actually get into human trials, and in their phase 1 trials, they had 45 volunteers aged 18 to 55, and basically they had 2 different dosages, one 100 micrograms and one 250 micrograms. So the 100 micrograms was used, that's the most important one due to the fact that it's used in future trials as well, and that's the main one which, when getting approval from the FDA, that's the one they focus on. And basically in all their participants, neutralizing antibodies were discovered, so that's a very good sign, and more neutralizing antibodies were produced than that of recovered COVID-19 patients. So the antibodies which are naturally formed, these levels were actually higher than that even. So that's really, really good. Another advantage of this, another great thing that Moderna has done, is that they received funding from Operation Warp Speed. So Operation Warp Speed is a public-private partnership done by the federal government of the United States to basically speed up the development of the COVID-19 vaccine. And basically the government has allocated certain amounts of money to different companies of who they deem worthy. So Moderna, they actually received $400 million plus, and after their phase 1 results were published, and at the moment they are starting their phase 3 trials. They're one of the few companies starting their phase 3 trials, so they're quite ahead, and I do think that they have great potential of actually achieving the vaccine. However, let's look at the adverse effects as well. Okay, so for the adverse effects, 3 participants in the 250 microgram dosage reported severe adverse effects. So I'm gonna link the adverse effects charts right over here, and basically this shows the side effects when implementing the vaccine. So it's a universal chart, and different companies, Biotechs, when conducting trials for the vaccine, will go through this, and their aim is to have the least severe side effect. So for the most part, all Moderna's volunteers were moderate adverse effects. However, 3 participants had severe effects, so that's not a good sign at all. Another cause for concern is the proficiency in the elderly. So in phase 1 results, the efficiency of the vaccine was not fully disclosed of the elderly patients, and that is still yet to be seen. So that's a huge thing, because we have to keep in mind that the elderlies are the ones who are in most of danger of the coronavirus, and due to that, they're also going to be the most in demand of the coronavirus vaccine. It's very important that a vaccine works for the elderly, or else huge clientele is lost. So at the moment, they're in phase 3. They have very good support by the government. They're well known. So if it's in your portfolio, keep an eye out on them. Ultimately, I'm here to show you guys the different companies in the race and who you believe, to be worthy enough for you guys to invest in, basically. Okay, so next up we have AstraZeneca. So AstraZeneca, they formed a partnership with the University of Oxford. They joined a little later than Moderna, but they are well on their way in developing the coronavirus vaccine. They are currently been approved for phase 3. They're a part of Operation Warp Speed. They actually received the second biggest award by the US government, $1.2 billion in funding. So that's quite impressive. In their phase 1 trials, there were 533 participants which were given 1 dose of their vaccine, as well as another 10 participants which were given 2 doses of their vaccine. So I'll leave the specifics here of the test results, but in brief, the group which was given 2 dosages experienced the most success. They had neutralizing antibodies similar to those of recovered COVID-19 patients. They also developed T-cell responses up to 2 weeks after vaccination, and held them for 1 month after. So that showed great signs of their vaccine holding up and there being a correlation. Once again, there was a doubt in terms of how it performs in their elderly. So that's following Moderna's footsteps in terms of the effectiveness in the elderly. So just keep a lookout for that. In terms of side effects, there are no serious side effects. Just some some soreness around the injection site, which is the lower side of the severity chart, which I showed earlier. So that's very good in terms of safety. Safety is a big part of the progression of these vaccines, and I think a lot of these companies could be ahead. One could be in phase 3 in comparison to another in phase 2, but any blip in security and safety could really delay that company in their vaccine pursuits. So having a secure and safe, criteria and guidelines of each vaccine is so important along the way, because if not, the success could really be tarnished down the line. Alright, so moving on, we have another collaboration. This time it's Pfizer and Biotech. So this company did not have any Operation Warp Speed funding. However, the US government did order $100 million worth of dosage of its vaccine, and another 500 million more if it receives the approval by the FDA. So these 2 companies were working on 4 possible vaccines for the coronavirus, and the FDA approved 2 of them to be fast-tracked. So that means the FDA works very closely with the company on these 2 vaccines in order for the timeline to be shorter and basically to remove a lot of red tape procedures. This helps the company reach the goal of its vaccine a lot quicker, as they don't have that middleman or barriers to communication, that direct communication with the FDA, and they're able to fast track their way towards attaining their vaccine. In their phase 1 results showed that in their 2 different dosages which they administered, they were neutralizing antibody production at 1.8 and 2.8 times greater than naturally recovered COVID-19 patients. So that's a very, very good sign. So another great thing about this collaboration is that they've also extended their roots not just in the US, but they've actually linked up with Germany and are doing trials there as well. So there could be potential of implementing their vaccine in Europe. So keep a lookout for that, because that's a bit unique in comparison to the other vaccine companies. So they plan on advancing to phase 2B/3, which is basically phase 3 of their clinical trials. They're just awaiting FDA approval, so keep a lookout for that. Anytime that happens, that's definitely going to affect their stock price, going to shoot it up a bit, so keep an eye out. Alright, so moving on, we have Novavax next. I'm sure a lot of you guys know about Novavax. They're quite popular, and Novavax's growth has been something quite spectacular, honestly. By around March-April, they're at $14 a share. Then they were working on NanoFlu, that's what their vaccine was called, and they were in the penny stock region a few months ago. They were not, they weren't that successful in their efforts, and they weren't really regarded as a reputable stock and a reputable biotech company. However, when working on their NanoFlu, they actually started to outpace their competitors and started to gain results, and that gave them a bit of traction. And then once the public found out that they're working on a COVID-19 vaccine, that also really helped them up. So when they first started on that COVID-19 vaccine, CEPI, which is the Coalition of Epidemic Preparedness, actually funded them $384 million. That boosted their share price from $14 to $40, which is a huge thing. And after that, they got granted a huge amount of $1.6 billion by Operation Warp Speed, which absolutely was huge. That was a major catalyst in pushing the share price all the way up to $100. And recently what's come out is that their phase 1 results have come out. So neutralizing antibodies were demonstrated once again, so they're well and truly in the race. I'll give you the details exactly of the test results here. You can check that out. But the main idea, like in other of these companies that neutralizing antibodies are there, another huge thing with them is that they have developed contracts with Japan and India, and in India in specific, in distributing their vaccines to these lower income areas in India. So that's actually a very big thing, because it's somewhat similar to what Pfizer and Biotech did in expanding globally, but having the idea of in these low income areas to get a partner and to distribute your vaccine there. That's very, very intelligent by them, because not only is that it's a very good cause in helping the people who are not going to be able to afford it a proper vaccine, but also in terms of their global reach of the vaccine. So Novavax is very, very well positioned. I'm sure a lot of you guys know about it. If you guys got in a few months ago, like when I got in Inovio, you would have made over 7,000%. It's quite crazy. So keep an eye out on it still. It still has a lot of room to grow. It still has a lot of potential. All of these do, because at the end of the day, they can still reach a coronavirus vaccine. So keep an eye out on it. All right, and finally we have the one and only, my favorite, Novio Pharmaceuticals. So I really want to be clear. I'm not going to be biased in this review. I know it's the biggest box here, but that doesn't mean anything. I'm being very unbiased in my review. When I am being biased, I'll let you guys know, but in this review I'm being unbiased and relying solely on facts and the production of T cells and antibodies, okay? So let's get into Inovio. So with Inovio, right now, it's just come out that they will be getting into phase 3 trials coming in September, starting in September. Their share price, I've just checked at the moment, it's actually plummeted quite a bit. I still have my share in it. I have around 35 shares. I bought at $16 a share, more when I'd averaged up. And at the moment I'm at a loss. A few months ago I was up over 100%, now I'm at a loss. That just shows the volatility of these vaccine stocks. It shows how you need to be doing your research, and you need to be staying up to date with it, and also not panic selling. So I'm still in Inovio because I truly believe in it. And so let me break down why, basically. So in their phase 1 results, which are very, very, they weren't efficient in depicting those results. They're still waiting for it to be published in a peer-reviewed journal, which, that improved the credibility of it and improved the reputation of it. But in terms of their press release of how they released their data, basically what they talked about with their phase 1 results is that antibodies were formed, neutralizing antibodies were formed, as well as T cells. And one of the big things about these T cells is that 90% of patients had T cell response rates. And not only that, but these were the CD8 and CD4 T cells. So I'll link up a video up here of one of my previous ones of what I talked about of the importance of these CD8 cells. So these are basically the cells which are, the killers of coronavirus vaccine. It was T cells, we don't know too much about it yet. We don't know too much about their importance. I talked about, finding a balance between antibodies and T cells and the importance of both of them. And so now more information is coming to light about what these T cells actually are. And so with the CD8 and CD4 T cells, they are key in immunizing against the coronavirus vaccine. Inovio is the only one which has talked about their CD8 and CD4 T cell response rate, which is a very, very good sign. Another huge thing about Inovio Pharmaceuticals is the ability for their vaccine to be stored at room temperature for a long period of time. So it can be stored at room temperature for, I believe, 1 year, and in a normal freezer for 5 years. It's a huge advantage over its competitors, because competitors need a very specific, cooling system for their vaccines, because once again, Inovio Pharmaceuticals is a DNA therapy vaccine. It's not like traditional in the vaccine which goes to the bloodstream. It is, DNA vaccine, which is very new, and so because of that, there's also more risk. So that's why the risk with this company is that since it's a whole new process of administering a vaccine, there is a higher chance of failure. But the risk to reward ratio, the reward is that it's revolutionizes a whole new form of vaccinations, not only in coronavirus, but then it has very, very amazing work done in cancer in terms of this certain brain cancer as well, which I'll get into in another video. But basically Inovio they're the key drivers in this revolution towards DNA vaccines and DNA vaccination. Moderna revolved around RNA vaccination, but Inovio is DNA, and I think they have huge potential. And if their vaccine does pull through, it's not only going to be just about corona, but it's going to be for the future, their impact they have as well. So another thing with these T cells, which was discovered on these T cells, is that a lot of patients had certain T cells without even contracting the coronavirus vaccine. This was done all through Inovio's clinical trials, and basically it was discovered that there could be some T cells which were formed through previous flus and viruses, and that could be a form of immunity for that person. And so that could also give more information and could be a reason as to why some people face more severe effects of coronavirus, and while some people don't have such a severe symptoms of coronavirus. And that, I think, is a huge thing, and that actually makes a lot of sense. I resonate with that a lot, because if you think about it, the more flus and vaccines you've had in the past, and you're developing these T cells, then that actually proves to be a strong likelihood that you would, as a matter of fact, be better suited to fight against coronavirus than normal people. And so the question I seem to always ask myself is, why do some people, why are some people dying, and why are some people just nothing's happening at all? They're asymptomatic. It's a huge development, and it's a great pathway to explore into and understand T cells. And I think T cells are going to be very important going forward, as well as already right now. And I think Inovio is a leader in emphasizing the importance of these T cells. In terms of funding, Inovio has funding from CEPI, so the Coalition of Epidemic Preparedness, as well as recently they've been a part of Operation Warp Speed for the non-human primate challenge. So that's the exact same thing, however, not on human trials, but on primate trials. So they were offered $71 million by the Department of Defense for their Collectra device, which is basically the device used to administer the DNA vaccine. What's more is that on an international level, Inovio has done really well, because they are already doing trials in South Korea and China. They're in phase 2, they're going to be starting their phase 2 trials there. So that's a huge thing, because they're going to be able to, like I talked about with Novavax and Pfizer in Germany and India and Japan, Inovio is really focusing on China and South Korea, and they're going to be able to distribute their vaccine if it's successful, but also they're able to do their tests and trials there and experiment with different strains of the virus as well. And so the key element with this is that Inovio will be able to booster the coronavirus, which means that if the coronavirus does become a seasonal occurrence, so like in the winter you have another strain of coronavirus, and then next summer it's another thing, etc., Inovio can offer, the vaccine could be always adapting to that strain of the virus, and so every single time it's like a little booster shot, so it's not going to be a big deal. You just get it done and you're good to go for that season. So Inovio is really focusing on that. They're focusing on the long-term goals, not looking at just now and releasing the publicity, but really understanding how they can avoid it long-term, how they can understand the T cells, the importance of them, and what they can bring for increasing this level of immunity and fighting the disease. So ultimately the key elements of Inovio is that, one, it's so safe and secure, and like I mentioned previously, one of the biggest downfalls of any of these biotech companies could be a blip in their security, a blip in their safety measures. And one thing that with Inovio is that they're very, very good in this aspect, and because of this, there's a lot of, their PR team is really weak. Investors, like especially day traders who are invested in Inovio, complain a lot about it because there's not enough news which is being portrayed in a certain way, which would catalyze and act as a positive catalyst for the share price. So there's a lot of problems with that. But in the long run, as a value investor for Inovio, I'm very happy that they actually are going through the safe routes, because in the long run I know that it's going to be effective and it's going to be better than any short little like 20%, 10% jump in the share price that I get from a press release. So that's a huge thing. Next thing is obviously its storage capabilities. Like I mentioned earlier, the fact that it's able to be stored at room temperature. Third, the fact that it's able to produce neutralizing antibodies as well as T-cell responses. And fourth, that it can be a booster, so for seasonal flus, for seasonal coronavirus strains, it can always be adapting. And fifth, it could have potential to be very effective in the elderly due to its results showing that it is very effective in the elderly. So that's another huge thing which Moderna, AstraZeneca, for example, we're not that secure on and we're not that sure on, was how the elderly would react to the vaccine. And remember, the elderly are the ones who need the vaccine the most, or the ones who have the highest demand for the vaccine. So if you're looking in terms of stock prices and in terms of shares, I mean, catering to that need of the older generation, that's going to definitely boost up manufacturing. It's going to boost up the amount of vaccines needed. It's going to boost up the revenue for the company, which in turn is going to boost up the share price of the company. So I really think Inovio is, for me, that's the one I'm invested in. And I might invest in some other ones as well, the other four that I mentioned. But for me, in my personal opinion, I think Inovio is the safest solely for the fact is my bet solely for the fact that it's so safe and they've gone through that boring procedure and they haven't given to that instant gratification of traders and consumers. They've really stuck to their own and done things which provide the results and provide the data, and they're going the extra step in understanding more and understanding not just getting an antibody. Like you have traders who are just like, all right, did this company produce antibodies? All right, nice, pump up the stock. They don't care about that. They're really focused on understanding what antibodies are doing, what the T cells are doing, the CD8 cells, CD4 cells, humoral T cells. There's so much to it, and Inovio is going step by step, and they're being so safe and secure with it. So I'm very optimistic about their work in this field and in developing this vaccine. All right, so to wrap it all up, who's going to win this coronavirus vaccine race? Honestly, I don't know. It's too early to tell. No one knows. No matter what anyone says, no one knows. I am betting on Inovio just solely for the fact of its safety and its and the transparent process that they've undergone throughout these months. At the end of the day, know that the vaccine, it's going to be beneficial for society no matter who does it, no matter what your personal interests are, no matter what stakes you have in any of these companies. And also another thing to really take note is that not one company can be the sole company that wins this coronavirus vaccine race. Moderna, they all, honestly, all of them could win. All of them could develop the vaccine. At the end of the day, it's all about who develops the most prominent vaccine and the ability to manufacture and scale on a global level. So if you have a stake in Inovio and you see that Moderna develops a vaccine, don't just be like, all right, I'm going to sell everything and move on to the next hot industry, whatever. It's not about that, because the company you're invested in could still produce results. They still could produce a vaccine, and there's also a reason why they got so far in producing a vaccine for coronavirus. Meaning, look at their other work as well. So if you're one of those investors who came in just for the coronavirus vaccine, look at the other work they're doing. Look at the other work they're doing in terms of different diseases they're dealing with, in terms of different technology they're using, the revolutionary ways they're using, because there's a reason that they got to that stage of being one of the top leaders in the coronavirus vaccine, right? This vaccine came out of nowhere. These companies were very quick to act on and very strong. So there's a reason that they're able to do that. So don't just give up on them. Do more research and understand other things they're doing. With Inovio, for example, the brain cancers that they're dealing with, Ebola. I know Novavax has also really good history with dealing with Ebola, and there's just a lot in these companies. They're really amazing companies, all of them, in my opinion. So stay invested, stay interested. Obviously, do your own research, do your own due diligence, understand why you're invested in something. Don't take a position just because Tony on the Yahoo Finance board said that, you know, AstraZeneca has coronavirus vaccine, his uncle from Puerto Rico told him. It's not about that. It's not about that at all. It's all about understanding the data. End of the day, the numbers and facts do not lie. Whichever produces the most antibodies, whichever is the most safe, whichever is the most durable, whichever is the most efficient, will be the vaccine that is used, and in turn you will also receive benefits for whatever stake you are invested in. So I hope you guys enjoy this video. I will be back to uploading daily vids. I'll get more into Novio. I'm going to get more into day trading once I head back to university starting in September. I'll get into the personal finance aspect of this channel as well, saving money, interest accounts, etc. So stay tuned. I hope you guys really enjoyed this. I really think as a global level we might be getting closer, we're getting closer to a new normal. We're getting closer to life as we knew it. Now's the time to stay working, stay focused, stay invested, and use this time to really level up and grow in terms of our investments, in terms of our learning and self-growth. So subscribe if you haven't already. Leave a like, it helps out a lot. And I will see you all tomorrow.